All right, we're moving on to functional squats and how we can modify these into a triplanar motion. So our standard squat is going to be feet about shoulder width apart, toes essentially pointing forward, and same plane going with your in a front to back plane. And we have our normal squat. Okay, but from the side you can tell that you get a decent amount of dorsiflexion into that motion, and you might have somebody that doesn't quite have that. Maybe they have Achilles tendonitis, maybe they have an inversion ankle sprain, that they don't quite have that motion. So then we want to be able to try to achieve a squat respecting their limitations. So say if someone has right Achilles tendonitis and they don't tolerate a lot of anterior translation of the lower leg, how about we go into a little bit of a split squat? Now I'm still starting to load my foot and ankle, load the Achilles a little bit more, but I'm not getting quite as much dorsiflexion as I was previously, right? Similarly, an inversion ankle sprain, they might not tolerate having their foot straight forward. That's a little bit more of an inverted position, so to speak. And so you could go into a little bit more of a sumo squat position, and they may be able to tolerate getting a little bit deeper with that compensation. Okay? As their impairments start to decrease and you're heading back into a return to sport environment or a return to work environment, then I think it's really important to get creative to put patients in different circumstances that they may encounter in real life. And so think about the different planes of motion in the sagittal plane, in the frontal plane, or the transverse plane that you can modify the squat in order to achieve more realistic movement patterns for your patients. So you could go into a staggered stance squat, okay? You could even modify that staggered stance squat into a little bit of rotation out, okay? Or rotation in, okay? You could go into another rotation squat with, say you're working with a cornerback, a football cornerback, and they're going to be in this stance ready to go in order for the play to start. And then they could, you want to be able to work in a transverse plane. Okay.